let's talk about skilled nursing facilities, or SNFs. In that world, communication isn't just a nice to have, it's the absolute heartbeat of patient care. It's that constant flow of info that keeps everything and everyone moving. So what happens when that heartbeat gets a little shaky, when the lines of communication get all tangled up? Well, today we're going to untangle that exact problem and look at a pretty amazing solution.
We are talking about hundreds of messages every single day. Think about it. Updates to families, coordinating therapy schedules, getting medication alerts, juggling staff shifts, and following up with doctors. It is a massive, complex, and really human web of information. And that brings us to the one question that keeps administrators up at night. In a system that relies on sticky notes, voicemails, and just hoping someone remembers to pass on a message, what happens when something critical gets lost? The risk of chaos isn't just a possibility. For many, it's a daily struggle. So yeah, this leads us right into the reality of the communication breakdown. And it's not usually one big explosion, but more like a series of small fires that pop up all day, every day, because we're using old tools in a super high-stakes environment. Just picture it for a second. The front desk is just swamped with calls from families who, understandably, are anxious and just want to know how their loved one is doing. Nurses are getting pulled away from actual patient care to play phone tag. Messages are scribbled on paper logs that are impossible to track. And on top of all that, imagine a family doesn't speak English as their first language. A simple language barrier can turn into a huge source of stress and misunderstanding. It's a system that can burn out even the most dedicated people. But there is a simpler way to connect, and it uses a tool that pretty much every single person already has right in their pocket. Yep, their smartphone. Let's dig into how automated text messaging can build a better, stronger system. It's fast, it's direct, and pretty much everyone knows how to use it. I mean, this comparison really says it all, doesn't it? You go from playing endless games of phone tag to getting instant, proactive updates right to your phone. You go from scattered paper notes to one central digital log of everything. Anxious families who are just waiting by the phone, they're replaced with families who feel informed and at ease. And maybe the most important part, the guesswork around language is just gone, thanks to automatic translation.
Okay, so this all sounds great in theory, but how does it actually work in the real world, day in and day out? This isn't about adding some complicated new software nobody has time to learn. It's about weaving simple automation right into the workflows you're already doing. Let's break it down into 4 key areas where this makes a huge, immediate difference. Number 1, keeping families and residents in the loop. 2, making sure appointments and therapy sessions actually happen. 3, getting the whole staff on the same page. And 4, smoothing out those super critical moments of admission and discharge. So first up, those family updates. Families want to be involved. They deserve to be involved. With automation, you can instantly and securely text a family about a new lab result, a minor diet change, or even just a simple, "Your mom had a really good day today and enjoyed the sunshine." You can't even measure how much anxiety that one little text can relieve, and it frees up the phone lines like you wouldn't believe. Now let's talk appointments. A missed therapy session isn't just a scheduling headache. It can actually set back a resident's recovery. But a simple automated text reminder for a therapy appointment or a doctor's visit, well, that little nudge is often all it takes to keep a resident's entire care plan right on track. It's a small thing that makes a huge difference. And of course, staff coordination. Let's be real, staffing is one of the biggest puzzles in any SNF. Instead of someone having to make a dozen calls to try and fill an open shift, an automated text can go out to all available staff in a single click. This works for everything: shift swaps, urgent openings, even reminders about mandatory training. It just makes the whole process so much smarter and faster. You know, all this efficiency is fantastic, but this technology is about more than just saving time. It's about being inclusive. It's about making sure communication works for absolutely everyone involved, no matter what language they speak or what question they might have. And this is where it gets really powerful. With multilingual support built right in, a nurse can send a message in English, and a family member can automatically receive it in Spanish or Mandarin or whatever their preferred language is. This simple feature tears down communication walls, builds incredible trust, and makes every single family feel like they are truly seen and heard. And get this, it's not just a one-way street. This isn't just about blasting messages out. When a family member replies back with a question like, "When can I visit?" or "Who do I talk to about billing?" the system is actually smart enough to understand what they're asking. It classifies the question and automatically routes it to the right person, whether that's the therapy department, social services, or billing. No more manual sorting of messages. So when you put all of these pieces together, what are we really looking at? What's the true impact of this kind of automation? Well, it's nothing short of a total transformation of the communication culture inside a facility. Let's just look at this before and after snapshot. Before, your staff's workload is sky high with repetitive, time-consuming calls. After, it's dramatically reduced, letting them focus on actual hands-on care. Family satisfaction goes from anxious and in the dark to informed and confident. Care coordination, which used to be prone to delays, becomes timely and synchronized. And message tracking? It goes from a scattered mess of paper notes to a centralized, fully auditable digital trail. So what's the big takeaway here? At the end of the day, automation frees up your best people to do their best work. It eliminates those dangerous language barriers. It makes sure nothing ever falls through the cracks. It dramatically improves the experience for both residents and their families. And it gives you a clean, compliant audit trail of every conversation. It's about raising the quality of care by fixing the foundation, communication. And all of this really just leaves us with one final question to think about. When you take a hard look at how your facility operates, is your communication system a tool that's helping you deliver better care? Or has it become an accidental roadblock, creating friction and stress for your staff, your residents, and their families? The answer to that question? Well, it could change everything.